Today's the day I move up to mounjaro 7.5 milligram. This will be my 9th week on mounjaro. Recently, I've had a lot of questions about whether you should be getting needles with your order. And the answer is yes. If you're ordering from a registered pharmacy, you should be receiving everything you need for that month. I use Health Express. On my first order, I get a Sharps box, but then I don't get one the following months. I have to let them know when I want a new one. It takes ages to fill up. Every month they supply me with my pen and at least 4 needles. You need 4. Sometimes they provide me with 7, but with each mounjaro pen, you need at least 4 needles. I'm so excited to move up to 7.5. For those that didn't know, I was previously on the high strength of Wegovy. I was on the 2.4 milligrams and I'd stopped losing weight due to inflammation of bad joints, other health conditions and perimenopause. So 9 weeks ago, I switched to mounjaro. My first month on 2.5, I was okay. I still had Wegovy in my system. However, when I moved up to 5 milligram, I've been starving. I've been so hungry. So I have been frustratingly patient waiting for the 7.5. Let's do my 7.5. First of all, you clean this red bit. A couple of taps to make sure there's no air bubbles. And then push on my needle and twist it on. Take off this big cap, but keep it because you'll need this. I take this off. That's the needle. So I dial it up 2 clicks, press the button. And I don't know if you saw, but the medication shot out. So that means the needle is in a fine working order. And then dial it up to as far as it will go. That does say 1. I presume that means 1 dose. I always inject into my tummy area. You do have to make sure it's at least You do have to make sure it's at least 5 centimeters away from your belly button. My tip is it doesn't hurt to inject, but avoid stretch marks because sometimes it can sting slightly. Push the needle into my skin, hold the pen firmly against it, and then I press the purple button, which is at the end of the dial, and that dials back slowly. When it's gone back down to 0, I then hold the pen against my skin for a further 10 seconds. This ensures that all the medication has gone into my skin as it should do. Then withdraw. You then get the big cap and you twist off that used needle just like that, and it goes inside your Sharps pin. You reapply the pen lid. This ensures that the medication stays away from bright sunlight. I keep mine refrigerated, but you can also leave it out at room temperature for up to 30 days. I wonder how I'll get on. Hopefully I have more appetite suppression. I'm hoping that I will. I'm hoping that I don't have any side effects because I haven't had any yet. And I'll come back in a few days with a midweek update or sooner if I feel any different.